So some real concerns about how we're handling the pandemic. The good news, of course, is the country is not in a third wave yet, but the figures are certainly heading there. Of our 9 provinces, the Free State is fully in a third wave. The Northern Cape never exited its second wave, with infections there surging recently again. Other provinces are also reporting increases. This, of course, just days before the big COVID-19 vaccination drive for the over 60s kicks off. And I'm joined now by Professor Mosa Moshabela, Acting Deputy Vice-Chancellor at the University of Kwazulu Natal's Research and Innovation Department. Prof, thank you so much for joining us. So we're not quite in the third wave. We were looking at the numbers a little earlier, and it seems that when we're starting to hit around 5,000 new cases a day, that will probably see us as a country in the third wave. Is that pretty much the benchmark for you as well?
No, I think absolutely. In terms of the technical definition, Sally, that would be the actual definition based on the 30% cutoff. But you can see, imagine if we have to wait until we get to 5,000, that will be a bit late to start activating a response. I think that technical definition of a third wave nationally would be appropriate if we were looking at a national response. But I think we work with a provincial response in this country. And a lot of the times we work with a district level response. So I quite like the fact that the Free State came out and said that they are in the third wave. The Gauteng has also come out and said that, look, they can see that it's coming pretty soon. Western Cape has done the same. And this allows us to now not focus on the national third wave, but to start thinking provincially and, where possible, even district. So I quite like the approach that we're having, which is more nuanced in my view.
Yeah, and we saw the beginnings of that with the second wave, where certain provinces were strongly locked down just ahead of the holiday season. Which provinces should be looking at perhaps lockdowns or restricting movement of people right now, this evening?
Yeah, I mean, I think at the moment, the province that we are most concerned about is the Free State. But the feedback that we are getting is that even the alert level 1 restrictions have not been adequately adhered to. And I think this is where, for me, I think that, as South African citizens, we have to be accountable and take responsibility. There's a lot that we can do with alert level 1 restrictions, and I really hope that Gauteng will heed the call in terms of the warnings that have been given out to start making sure that at least we optimize adherence to level 1 restrictions. If we can do that, we may even find ourselves in a situation where we don't need any further restrictions, say having to go up to alert level 3. I would hope that provinces like Kwazulu Natal and the Western Cape are actually watching what's happening and they're preparing themselves in order to make sure that they can mount an optimum response.
All right. So is there any way to avoid a third wave at this point? Is it just inevitable? It's just how big it's going to be?
That's a very good question. I think that, if I look at it from a public health perspective, yes, there is a way to flatten the curve, not to avoid it. I think that I agree with the minister when he says, for all intents and purposes, we are in a third wave, considering the fact that some provinces are in the third wave. We may go back to a technical definition and say no. And because of that, I think that we must accept that it is something that is happening already, even though it is not yet at a scale that we have seen before. And preferably, we should not see it at that scale. And I thought that when the minister was saying, we are in a third wave and calling for stronger containment measures, I thought that what he meant was to avoid a high peak of infections in the third wave and a more concerted effort, calling for a more concerted effort to flatten the curve a lot more. So for me, I think that we are in the third wave, but what we can do is reduce the potential harm that can come with it.
All right, so suggesting, when the minister's saying, look, we're not actually technically speaking in it, but we need to act as if we are in the worst of it before it's too late, I guess. And, I think this comes at an interesting time, this conversation, because On Monday, we're going to see the beginning, hopefully, of phase 2, which is the major rollout. It is targeting some 5.5 million South Africans aged 60 and above. And today and yesterday, we've seen a lot of chaos around finishing off that eNCA trial. We've seen people, it seems, able to register themselves as somehow affiliated to healthcare workers, jumping the queue, getting jabs, when healthcare workers, legit healthcare workers, are left out. This is really worrying if we're going to use the same system, which I understand we are, come Monday. It suggests security is not going to be that tight, that people might turn up, take a chance, and cause chaos and potentially super spreader events. How worried are you about Monday?
So I actually think that, you know, what we have seen so far with eNCA, we've learned a few lessons. And one of those lessons is that the hospitals are not ideal environments for vaccinations. I think they can do some vaccinations, but what we should be really looking at is vaccinating away from these places. They are designed more for treatment of diseases. And so I would really hope that as we expand from Monday, we think about a different model that is a lot more decentralized. And I know we've spoken about this, but there is this thinking that vaccination needs to happen in health facilities, and I don't understand that, because these people that we are seeing are not necessarily sick people. What we need to do is to make sure that we consider the context of the third wave, that we must avoid gatherings of large people in these spaces. And hospitals are not ideal. They are contained, and the chaos that we've seen could have been avoided. But then again, I think that we also have to think about the participation of the citizens and the role that the citizens play. I don't understand at this point, Sally, why we still have a third of people over 60 when we knew nearly a month ago that these people are need to be registered. I believe that every person over 60, maybe nearly all of them, would probably know someone who's young who can get them enrolled onto EVDS. If all these people are enrolled and we don't have enough doses, we can then say the government is failing us. But when we are not necessarily enrolling people, then we have to question our own participation in this process. And that same thing goes to the people choosing to jump queues and all of that. I think that that's an ethical practice, and we should call it out.
Absolutely, and thank you so much for your time this evening. Much appreciated, Professor Mosa Moshabela, Acting Deputy Vice-Chancellor at the University of KwaZulu-Natal's Research and Innovation Department.